But it really does boil down to what steps can we take as a society, as a country, to encourage people to behave better so their health status is better. And that gets you some very controversial issues.
Mm-hmm. Yes.
Jim talked about charging people more who didn't behave correctly. That's a controversial position, and he found out that the law wouldn't allow him to do that. But these are the kind of questions that we've got to really think about. What is appropriate for the society to do to get us to behave better, to have better health status?
So you're talking incentives and disincentives,
Yes. Right.
to wellness,
Yes.
for taking care of
And
yourself.
Bill, there are projects going on around America. One called the 10-City Rollout of the Asheville Project that Ken is very familiar with the Chronic Disease Coalition. In those businesses that participated, they offered incentives to their workers to get diagnosed for diabetes or asthma. But the deal was you had to sign up for treatment. You had to be compliant with your medicine. You had to be compliant with exercise and diet. And you had to be agreeable to be tested regularly. The studies at Asheville produced a $2,200 to $2,400 saving per worker per year to the company when that program was installed. In 5 years, not a single diabetic patient was filed for a disability. Their time lost on the job went way down, their productivity went up. Many of the companies went back to their insurers and got premium discounts for their workers. There are formulas, Dick, that are out there. And there are various companies exploring those formulas, just like Jim is, that involve more incentives and less penalties, but dollar incentives, actual rewards for workers who behave properly, who become more productive, because it's a win-win for everyone.